Hello everybody, this is Dr. Kolbenson. I am an internal medicine doctor working in Saskatoon. I am the point of care ultrasound lead for the Department of Medicine. In this video, we are going to go over following our needle tip with ultrasound using a out-of-plane approach. This will be a useful skill to develop both for peripheral IV insertions with ultrasound, as well as for central venous line insertion. We have our ultrasound here, our vascular access task trainer, as well as our needle. When setting up to perform an out-of-plane approach needle insertion, we want to have our probe marker oriented the same way as the screen. The screen marker will be on screen left, so we will orient our probe to the left so they match. And you can visualize that we have a vessel under our skin here. And in an out-of-plane approach, we are going to visualize the vessel in its short axis or out of plane. Whereas in an in-plane approach, you would be visualizing the vessel in its long axis or what's called in-plane. Similarly, in an out-of-plane approach, we will be visualizing our needle out of plane. So it's going to look like a dot rather than visualizing our needle in plane, where it will look more like a needle. The out of plane approach is preferred as it requires less fine control of the probe when making movements. To get started, there are some basic probe movements that we need to go over. What we can see on our screen here is our vessel under the skin. And to center our vessel on the screen, we need to slide the probe to the left and to the right. And we can see that sliding left and right will help us center our vessel on the screen. Following the length of the vessel will be sliding forward and sliding backward. So sliding the probe left and right, forward and backward are going to be the main probe movements that we'll be making when we do this task. The other probe movement that we may need to make to help us visualize our needle tip better is fanning the probe like this. So sliding like this and like this, fanning like this. I've made these probe movements more exaggerated. When we actually perform our needle insertion, these probe movements are very, very small. So we now have a picture of our target, and we want to set that up right in the middle of our screen. The reason we do that is because on the ultrasound probe, there is a line that corresponds to the middle of the probe. The middle of the probe and the middle of the screen are the exact same. So it just helps us orient us so that we can make sure we put our needle in on the right path. I have a 18 gauge IV here that we will be using. The larger the gauge, the easier it is to see your needle tip. So the first thing that we want to do is scan along our vessel and find an area where we think we want to puncture. So I'm going to choose right here. The next thing to note is how deep is our vessel. So if we look at the hash marks on screen right, we can see that our vessel is about 1 centimeter to the middle of the vessel, and maybe a little less than that to get to the near field wall of the vessel. So the next thing that we are going to do is we are going to start our needle insertion back the same amount that the vessel is deep. So I'm going to start, between 0.5 and 1 centimeters back. I'm going to line up my needle so that it is right in the center of my probe, and we are going to insert our needle at a 45-degree angle. The first thing that we're going to do is just insert just slightly under the skin. So our needle has penetrated into the skin. Now what we're going to do is we're going to slide our probe back towards the needle. And as we do that, we're going to do a very small in and out motion with the needle tip so that we can find our needle tip. And you can see that as I go back towards the needle, I can see the needle tip on the screen right there. So now that we've identified our needle tip, we can start what is called the creep method. To perform the creep method, what we are going to do is after we've identified our needle tip, we are going to slide our probe away from the needle so that we can no longer see the needle tip, and then advance our needle until we can see the tip again. So there we see the tip. And we're going to do this over and over again until our needle ends up in the vessel. So we slide away till the needle tip is gone, and then advance till we see it. And there it is right there. Slide away till it's gone, and advance till we see it. Slide away till it's gone, and advance until we see it. And there we see our tip right in the vessel lumen right there. Now, when we are in the vessel lumen, we want to make sure that we are right in the middle of the vessel. So again, what we do is we slide away until we no longer visualize the needle, and then slide towards the needle, and that first thing we see is going to be the tip right there. And now we can see our vessel and our needle tip right in the center, just like that. Now, when you have the needle tip right in the center like that, that's what we call the bullseye sign, and that's what we want to see. That is when we would consider the next part of whatever procedure we're doing, whether it's threading a wire or whether it's inserting our IV cathalon. So we're going to go over that one more time. So again, we're going to find our target. So there's a nice area right there. We're going to put it in the center of our screen. We are going to note how deep the vessel is. And then we are going to start back from our probe that same distance. We're going to make sure that we're inserting right along the center of the probe, and we are going to insert at a 45-degree angle. We're going to get started just slightly under the skin, slide towards the needle while slowly making this in and out movement until we visualize our needle tip, which we can see as a bright dot on the screen right there. Then we are going to proceed with our creep method. So we creep away, advance the needle till we see it, creep away, advance till we see it, creep away, advance till we see it, creep away, advance till we see it. Now we have very clearly gone into the vessel. Now we want to make sure we've got that bullseye right in the middle of the vessel. So we creep away and we slide back to see where we are in the vessel. So we could go a little bit further. So I'll creep away, advance a little bit, creep away, advance a little bit. So now when we creep away and come back, we can see our needle tip right in the center of the vessel. Good. Now, if you're having trouble visualizing your needle tip, there's a few things that you can do. So this in and out movement is a good way to help direct you to where your needle tip is on the screen. So we don't want to make a side-to-side movement like this. We want to make a very slight in and out movement like this. The other thing that we can do is we can fan our ultrasound probe slightly like this. The reason fanning the probe can help us see our needle tip is that sound likes to hit things at 90-degree angles. And when we are having our probe in this orientation, the sound is hitting our needle not at a 90-degree angle. And so it's not as easy to visualize. So if we fan just a tiny bit, we can make that angle 90 degrees. And you can see that our needle tip shows up as a much more discrete circle on the screen. And those are two ways that we can help visualize our needle tip. This movement and fanning, so that our sound is more 90 degrees. Now, the reason why the creep method is so important is because when we are doing procedures that involve needles, we want to make sure that we always know where the tip of our needle is. And if you image the needle along its course, it will look the same under the ultrasound. The creep method helps us know for certain that we are actually seeing the tip of the needle. So let's see if we can have an example of that. So again, we come back and we find our needle tip. Slide away, advance until we see it again. Slide away, advance until we see it. Slide away, advance. And there we see it right in the center of our lumen. Now, I know because I'm sliding away and then sliding back that that's the tip of the needle right there. But if I advance further, we can still see at this point that there is, an echogenic area in the vessel lumen. And it might look like it's right in the center, but when we slide away and then slide back, we see that the tip is more so near the far wall. Now let's put the tip all the way at the far wall. So here we see our tip is all the way at the far wall. Now if we come back along the shaft, you can see that we can still see the shaft, and even right here, that almost looks like the tip of our needle, and it looks like it's more so near the near wall. But we know that the tip is in fact at the far wall here. So it's very important to do this creep method so that we know exactly where the tip of our needle is. Because if you were confused and you thought this up here was the tip of your needle, when we know that in reality that's the shaft of the needle, and we advanced further, then in reality you'd be going close to going through the back wall and your procedure won't be successful. That's it for today's video. Thank you very much for your time and good luck with scanning.